He said he's just in there playing games.
It's somebody else.
I'm not meeting.
Hey everybody, if you can make sure you mute your computer. Yep. Oh, looks like we have, pretty good. Fantastic. Are we ready to get started, everybody? Well, welcome to the 2025 open enrollment meeting for Henry Stark County Special Education. We're going to cover a few things. Steve Leisman and Lance Leisman are with us here again today. They're going to cover some of the highlights of the plan we have, but I'm going to lead with there are not a lot of changes, very few, if any. I will tell you that right now. I will then cover a few things with you before you take off. And at the same time, if you've got questions, we do have the chat open up on the side, so you can go ahead and type in a question. If you have one, we'll try to get to it and go through them. If we don't get to it, know that I will make sure that I get it to you or get an answer to you within the next 24 hours to answer that question. But we'll try to get to everything. So, but just type them in the chat box there and we'll roll through this. And again, if you have your microphone on, go ahead and please mute that. I think we have everybody, or at least I think I did, but we'll find out. I'm going to turn it over to Steve and we'll go from there.
All right, well, thank you. Lance and I are extremely grateful for the opportunity to continue our partnership. Greg and the membership here have made it so easy. With no changes to the premiums, which we get to say basically never anymore. And also no changes to the coverage as far as the health insurance is concerned. It makes it a really easy meeting to go through. We're going to focus on the plans, but what we're going to put special emphasis on is how can we save money? Now, if we know what the plans are, we're getting comfortable with them. What are some cost saving items that people are missing? I mean, you're working all day, you're raising families, you're taking care of other people's kids, to be honest with you. How can you take care of yourself and your home in a practical, effective way? So I'm going to go over just the basics right at the beginning. January 1st is our open enrollment period. That means that any eligible employees of the district who are not currently participating have the right to sign up for 2025. It means that every employee who is eligible and participating has the ability to change what plan they're in, to add dependents. What are dependents under our program? Well, they're obviously your married spouse or your children up to age 26. and your children up to age 26 no longer has the qualification like the old days of they have to be in school or they have to be on your tax return. Nothing like that. If they are your child, your stepchild or adopted child, and you would like to add them to this program, you absolutely can. If you decline this opportunity,
You're saying you can't hear us very well. They say it's muffled and 2 hour week. Can you bring the laptop closer at all? Towards it. Yeah. We're trying to get a little bit better sound for everybody. I know some people are saying it sounds a little muffled.
is that any better? That better? How about this?
Worse. Yeah. Somebody's got, you gotta turn your mics off, guys.
Yeah, they have no problems. I'm thinking someone is turned on. I'm really gonna hear people running blocks.
Yeah.
There's a cat. Is that getting?
There you go. Brother. There we go. All right. Think we have everybody. Okay.
Oh, we're so sorry for that, but we want everyone to be able to hear. Can someone acknowledge?
Sounds good now, I get. Okay.
Okay.
Crystal clear. Yeah.
Thank you. So just to quickly paraphrase, thank you. Your open enrollment period is January 1, and this allows you to join the programs if you're eligible and have not done so. It allows you to add your dependents, and that is children up to age 26 or your spouse if they are currently not participating. And if you decline this opportunity, you could not join until next year unless you have a life qualifying event such as marriage, birth of a child. Maybe you're covered by your parents and you turn 26. Maybe you are on your spouse's plan and it's awesome, but your spouse retires, quits their job or gets laid off. But if you're in some state of confusion over what and what is not a qualifying event, feel free to contact Jennifer, myself, or any member of our staff. We'll be glad to help. As Greg said at the beginning, there are no changes to the health benefits and there are no changes to the price, which is awesome. So I'm going to go over a few of those things. But Greg, you have a new enrollment system that I think is going to work out great for long-term efficiency. But anytime there's a new system, I've been around the block, sometimes there are glitches. So what are you asking people to do?
Okay, so this year, for your health, dental, life, and your vision, you will be doing your enrollment through your Skyward account. Okay, Jennifer will be sending specific information of how to do it. It's not that hard. Trust me, I was able to do it all by myself today without any help from anybody. So I was kind of the tester, and if I figured it out, everybody else can. So you will go into your Skyward account, and then there's a section there for open enrollment, and you will go in there and you will check what health plan you would like to have, what dental you'd like to have, your vision in there. Again, vision is voluntary if you choose that one. And then the life policy that is in there, the only one that's in the Skyward is the $25,000 life policy that we carry on you. If you want to do the involuntary, I'll talk about that. You'll have to do that one on paper with Jennifer. Now, if you do not know what you have this year in your health plan, or if you have your spouse or your family, or if you had bronze or you had silver, please reach out to Jennifer and she will send you something telling you exactly what you had. So that will be for this year. Going forward in years advancing down, you will have those side by side. So when you do this in 2026, it's going to have what you had in 2025 and then what you had in 2026, what you're going to choose. So you'll be able to look. But this year, since we're building that system, we will, if you aren't sure, there's a box right at the beginning of it that says, and you can click it one time and it says, keep my plan exactly the same that I have this year without having to do anything else, and you're done. But if you're not sure and you want to check it, just ask her and she will send you something that tells you what you have this year, okay? But that's how you're going to enroll.
Okay. Well, coming to this first form, there are a few paper forms that are required this first year. Voluntary life insurance. Now, we're going to go over the whole benefit package. The portfolio is very extensive, but voluntary life insurance means you wish to purchase additional term insurance on yourself, spouse, or children over and above what the district is providing. That also means you will pay for it. With this changeover in the enrollment platform, everyone needs to redeclare now. So you need to fill out this form. You do not list your premium amount, nothing like that. But say that you wanted some on yourself. If you look at this form, yes, I would like to enroll. Coverage amount. We are talking about the death benefit, $100,000, etc. If you want something on your spouse, same thing. Children. Spouses and children cannot elect coverage without the employee being covered. For those employees who are currently employed and have waived this opportunity before, if you enroll, you will have to answer health questions and you are not covered until Jennifer is notified in writing that that has been done. Okay. If you are on the plan now, just want to keep what you have. Steve Leisman, $55,000. If I wrote that, we'll cross-check it. You're grandfathered in. There will be no additional paperwork. Anyone who is currently covered can increase their amount by $10,000 with no questions asked. You can increase it by $40,000 if you want, but other than $10,000, you are subject to medical questions again, and same for your spouse. So we can help you with that if you want. Okay. There we go. We also want you to complete this coordination of benefit form. The coordination of benefit form will greatly speed up claims that have been pended in the past. So now switching over to, hey, if we're not changing things, how can we improve the process? Well, we get claim inquiries here all the time, and we want that. Please, I don't want you to call an associate. You can if you want. I don't want you to try to fix it yourself. I want you to contact me or my office, and we want to help you personally. And we will, although we may fail. And we may get in a situation where you're going, how can they possibly be asking for more information? But I promise you effort and engagement. But if we can fill this out at the start of the year, we're going to think it's going to solve 5 to 7% of the claim issues. That's not all of them, but 5 to 7% is great. These are your employee withholdings. I again would tell you, thank you, Greg. Thank you, district. Thank you, your union committee. No change in benefits, no change in price in 2025. Doesn't even happen at McDonald's. It is happening at this district. So congratulations. And one of the reasons it is happening, not the only reason, but a paramount reason. Greg had the foresight several years ago to join the Pareto Health Insurance Captive. There are now over $1 million in your 1 million people in your co-op. With 1 million people in your cooperative, your buying power is spectacular. Your ability to get first-class, best-in-class vendors is definitely an upgrade. And it's also going to promote long-term stability. So congratulations. We encourage everyone to fill out a paper beneficiary form and submit it to Jennifer if you are unsure who your beneficiary is. Now, you don't have to do this unless you're applying for new coverage, but it's still a good idea. Service questions, you know how to email, call us, Midwestern Insurance. I think you know by now, even if I give you bad news, if you call my cell phone, I'm going to answer it and I'm going to call you back. Same thing for Lance, same thing for our office. Please let us be your first line of defense against the insurance company. If you wish to call Consociate directly, you are certainly welcome to. Same with United Healthcare or Humana. Consociate. Now, I think one of the things that if I get 10 calls from our membership, and I hope I get a lot of calls. You might think I'm lying, but I'm not. I want calls, so I want you happy. One of them will be, they don't take our insurance. Aetna doesn't show me in the plan. Okay? You don't buy insurance from Aetna, folks. You're in the Pareto Cooperative. Consociate is managing it. Aetna is our rented PPO network, along with our agreement with Springfield Clinic. Your doctor, hospital provider should submit their claims to Consociate. If they need to verify participation and eligibility, it's Consociate. It is on your card, and I understand the confusion. I'm not blaming anybody. I know it happens, but have that in your mind. Our insurance is Consociate. Our PPO is Aetna. Okay? And I do think every year that you don't make changes, that will, help solve itself, because now you're going to be in the doctor's system correctly, but remember that long term. Our United Healthcare life insurance, this is what's provided by the district. $25,000, pays double in the case of an accidental death, costs you nothing. Here are the supplemental life rates. So these are clearly printed in the packet. They did not change. However, as we've talked about year after year, if you are in the voluntary life program and during 2024, you encountered a birth date that moved you from one age band here to another, then you will have a personal rate adjustment at the renewal. If you are unsure how to compute these numbers, you let me know and I'll be glad to cost them out for it. Okay? That is the supplemental life. Then our Humana, 200 vision, not changing. Why is it not changing? People like it. So I hope everyone's had the same experience that we have here. We do have this vision plan at our office. Just remember, Humana is your insurance company. But again, going to provider confusion, iMed is your PPO network. So your eye doctor should be looking in the iMed system, which is the second largest PPO in the United States. They should come up, Steve Leisman is eligible. He can have services every 365 days. So everything else that we're talking about today is a calendar year situation. Vision purchases are 365 days in between. So if you go to a PPO doctor and you have 365 days in between, a reasonable expectation is to get an eye exam probably for nothing, $200 worth of materials for free, and an enormous discount on anything else that you're buying. I think now we would know our membership. We probably had people getting $500, $600, $700 paid or written off by the plan. That's one reason we're keeping. Now, Greg really went to bat for you one more time on the dental plan. So last year, if you remember, we went from Humana with a $2,000 annual maximum they would pay for any one person to a $5,000 per person. People might think that sounds like a lot of dental insurance. It is. When it comes into play now, it happened to my wife. I mean, we have this too in our office. She had 2 crowns this year and a root canal. She would have maxed out before. Now we're still collecting. And you also bumped up your braces for children, not adults, to $2,000. So remember that happened. But Greg, you want to talk about the extra coverages you put in? It's really nice.
This year we put in there the the implants in there because that's becoming more now. It's dental insurance, so you gotta remember, it doesn't cover anything cosmetic, okay? So if you want to get a nice implant cosmetic tooth in there, it's not gonna be covered. This is implants where they might have to go into the bone. It's a costly procedure, and it's one of those that, it's a nice piece to have within there. What else did I throw in there this year?
Well, I do want to say that on any dental service over and above a cleaning and filling, implant, crown, bridge, root canal, please get a pre-estimate. We have written this plan so that you can go to any dentist. But if you go to an out-of-network dentist, which will be most of us, including me, it doesn't pay quite as well. So we don't want any surprises. And I would tell you on implants, you're gonna hear that, implants? I see these every day. Talk about cost differences. In a 10-mile radius, you're liable to have someone who charges $1,200 and someone that charges $10,000. This is not an emergency. In advance. Shop around however you want, you're smart people, but definitely get a pre-estimate and make sure anything over and above a filling, you're getting a pre-estimate on it. Okay. I also want you to make sure on the vision that you're in the PPO network. There's no such thing as an emergency on a vision plan. It's a eye exam, glasses, contacts. Okay. Now, our health plans. This is our PPO plan. Do I feel it's confusing? I do, but it's confusing in your favor. So when we put in the Springfield Clinic component, and we did this for many people, thousands of people in Central Illinois. I don't know how to do any one of your jobs. They're important jobs, and thank God you're doing them, but I don't know how to. I can't fix the car either. But I know how to do this. You want to look at the middle column. That is the basis of your benefits. If you can seek or wish to seek treatment at Springfield Clinic, you'll greatly decrease the amount of money you spend during this year. If you go to the middle column or the first column, they are commingling. So you are not running a $750 deductible in Springfield Clinic and $1,500 at OSF. Whatever you spend in that combination cannot go over $1,500. So there is no penalty, only reward. Can you go to OSF in the afternoon and go to Springfield Clinic next week? Absolutely, you can. You do not have to get prior approval, nothing. We're just trying to get you a situation where, first of all, you can get access to excellent doctors, because it's hard to get doctors anymore, someone who's taking patients. And then also, if you're going to have any type of surgery, can we cut your cost in half? So the middle column, same thing we've had for several years. $1,500 deductible per person per calendar year, with a limit of 2 per family. But many things aren't subject to deductible, such as a physician, primary care copay $30, specialist $50, urgent $75. You got an outstanding drug card, 10, 40, 60, 150 for special. If you never went to Springfield Clinic, if you're thinking that's too far to drive, you don't have access, no one cares. Stay in the middle column, you are well served. But if, like me, I grew up in Peoria at the Springfield Clinic on Allen Road, that's my dermatologist now. And I've got skin cancer again, I'm being treated right now. They treat me great. They got me in less than 24 hours the last time I called. Good doctors, well, I'd be paying half for the care I wanted anyway. Their surgical center on North Knoxville, not too far from Avanti's. State of the art. I've toured it. It is clean, impressive. I urge you, why not get an outpatient surgery there and pay $1,750 instead of $3,500? But I think you get the idea. Greg, have you been hearing, are people happy, satisfied, or not?
We've been seeing quite a few more taking advantage of the Springfield Clinic. They continue to expand. And when I get the reports, we have a lot of people accessing quite a bit now. I haven't heard anything negative about Springfield Clinic.
And people call in and they should. Consociate has a Springfield Clinic concierge office, and they will even, with you on the phone, put you on hold and get you an appointment. So feel free. This girl's named Sharon Oliver, but if you just call Consociate, say I'm a Springfield Clinic Advantage member. That's all you gotta do. They'll send you over. You can say, can I have an OBGYN? Yeah, Crowley Mueller Teverbach. Can I get a blood test here? Can I get an x-ray here? Or do they have orthopedic surgeons? Now, sometimes they won't. They're still expanding into the Peoria, Kewanee area, and they are not up to the Quad Cities yet. I got that. But so what? In the middle column, you can go to, as far as I know, all of the providers in your service area from Kewanee into Iowa and the whole shop. Okay.
Everything's in Indiana.
Yeah. Now, if we look at that drug card, well, that's great. Go to CVS, go to Walmart, wherever you want. But by now, have people figured out that Smith RX is not your enemy? They are your friend. They are trying to get you medications for free, or at least at a greatly reduced cost. So if you are contacted by Smith RX and you're not sure if it's a scam or not, identity theft's for real. Take down the number, contact us. We will have Smith RX verify. Yes, they're trying to reach you. We'll put you back in touch and you can take advantage of the program or not. And I know we're going to talk about HealthJoy in a minute, but as of January, HealthJoy is going to be integrated with the Cost Plus portfolio, and you will be automatically told of your options, but not compelled to take them through the HealthJoy app. Now, this is your HSA plan or your baby plan. What do you usually see for this, Greg? What are people using here? Are they happy?
The silver plan is if you know that you have a pre-existing condition. I would say 90% of our individuals that use our silver are having babies or something along those lines. It's pretty simple with that when you're looking at it, if you go through Springfield Clinic, your deductible is $3,300. If you go through an Aetna network, it's $3,800. And then once you hit your deductible, everything after that in the Springfield Clinic is covered 100%. And in the Aetna network, it's covered at 80% across the board then for everything. So it's a nice plan with that. If you're having, if you have a baby and you go into the Springfield Clinic network, it's going to cost you $3,300 to have a baby out the door. And everything else in the rest of the year is covered at 100% if you continue to go there. If you go to the Aetna network, it's going to cost you $3,800, almost $3,900 it's a pretty good. If you have something, you have something, utilizing the silver plan will work out for you at the end of the day. So that's why we keep it as an option.
So for me personally, and I do want to say in the Aetna network, it's 80% not unlimited. Once you've paid $4,000, you pay no more. But I told you, I talked about myself. I already know that I'm going to be cut on in January. I'd probably be there for 2 hours. I probably won't miss 3 hours of work. I'd hit that $3,300 and I'd be done for the year. So I know that I would select that program in that situation. And these are just an itemized breakdown of what we just showed you. I know they're hard to read, but they're in here. I hit that, I would fund my HSA or my FSA, because you have an option here. We'll talk about it later. Fund it to the $3,300. I'm all set. Now, another thing that we are constantly getting, and I understand the frustration here. People with a blood test, it seems so simple. It's a blood test. I'm not afraid of blood tests. I have them all the time. If I do, I would think, oh, that took about 10 minutes, but it costs $100. No, $800, $900, sometimes at a hospital. We are giving you the option to use Quest, and if you're on the PPO plan, get it for free. If you're on the HSA plan, you'll have a small copay now that COVID rules have been relaxed, but it's small. But I can tell you this, something that is usually an $800 service at the hospital, it'll be free if you go to a Quest facility. Okay, and where are the Quest facilities? Well, there's one by Dixon's Fish dock or whatever you want to call it by the boat in Peoria, but your health department.
Our health department is West in Kiwanee. So you can go there and have blood drawn. It's not going to cost you anything.
And the last I knew, they were so accommodating there that you could get the first appointment. You can actually get an appointment if you call ahead, be the first one there, draw the blood. Oh, did I spend $800 this morning? No, I spent nothing. And then go to work. Here's how to print a Quest card. Okay. HealthJoy, no one is a nicer advocate that we work with or more knowledgeable on HealthJoy other than the people who work for HealthJoy than Greg. So how have you been using your plan and what your people been doing?
I would say it's probably one of our most underused pieces. It is an app, HealthJoy is. It is an AI component that if you have the app, it can help you navigate, it can help you find different individuals for different things you have, but it also has a wallet in there. And when you, and I'm going to go through this later in the week and get real specific with things, but I highly recommend if you have our insurance, download the HealthJoy app. You'll put it in there. And then in there in your wallet, it will have your associate health insurance card in there. It will have the information related to the HealthJoy in there, or I'm sorry, HealthJoy. Also have like the Hscsed in there, which I will cover later on with that. It also has, there's the virtual piece to it as well. So you can click on it, and if it's a Sunday evening and you're feeling bad, or anybody in your household, they don't have to be covered under your plan, can use it. It's click on there, it says virtual, like Walmart virtual, you'll click on it. You'll need to set up an account, so go do that before you need an emergency situation. But it's MeMD, and you can do a virtual, actual doctor right there, and they can help cover a lot of different things at that time for you. So that's in there. It has lots of different information. Heck, there's an exercise piece in there too, and it can send you like a daily exercise if you want. I'm telling you, it is an excellent piece. Please go in and download that and have that available because it has all this information in there for you.
And the chat feature is nice.
Yeah.
Now, as I did say, there's already an easy button for 406 savings. This is going to have a substantial upgrade January 1 for people who are already loaded in and using the app. This would tell you what your contributions limits are for health savings accounts for people on the silver plan in 2025. I think for the Aetna situation, the main thing I would think of is they're not your insurance company. Don't call Aetna. If you call Aetna, they're going to say, we don't know who you are. You're not covered. Everyone's going to get excited. Call Consociate. Aetna is being rented as your PPO network. Now, other than that, these are all compliance pieces. Do we have any questions in the chat?
I've
answered, Greg.
I've been answering this up long, so. Yeah, you can look through all those extra pieces that you leisure there. It's like an IEP, guys. There's a whole bunch of extra pages that you don't seem to need all the time.
How about the KISS card, Greg? Do you have any examples of people who save substantial money?
Yeah, I mean, the Hscsed card, or you'll look in there, it's called Valencia, or Valens, I think is what it is now. The key component to if you have a surgery that you know that's coming up, and it's one of those things that you can plan for, this is the perfect system for you, because it doesn't go against, you don't have to pay any of your deductible. So you'll go in, you'll get a referral from your doctor. We actually had a employee of ours had a hip replacement, and he looked at the referred doctors within this whole system, the Hscsed system. He picked the one that he wanted. He went and had his hip replaced. And at the end of the day, it cost him $0. So there's no deductible. There was no 80%, no, nothing. It costs $0 at the end of the day. If you're getting a colonoscopy is covered by our plan, okay? But when you're out and you're asleep and they're doing the colonoscopy and they find polyps, it now changes from just a colonoscopy to an actual surgery at that time. So you're going to wake up from that and you're going to find out you have a bill because they had to remove polyps. If you use the Hscsed system, you would go in there and no matter if they found polyps or not, you walk out and it's still $0. It doesn't make a difference at all. It works very well. I'll give more information on this. I plan on going through all of our benefits that we have in a little bit more detail for everybody. This is kind of an overview, but then I'll give a very specific detail and you can ask me questions and that at the same time. But Hscsed is kind of, it's big. SmithRx has been monstrously huge. They've done a great job. It's accepted everywhere. And they, if you have a very expensive medication, they're going to reach out to you and they're going to find a way to find it cheaper for you. There's a lot of different pieces to it at this time. So.
Yeah, I think our access to diabetes medication starting January 1 is going to be a big situation. The Cost Plus program specifically targets, we want diabetics to get their medication at an affordable rate and conveniently. So if you are on any type of diabetic treatment now, which so many Americans are, and you're looking for cost savings, shoot us an email. We'll hook you up with the right people. Maybe we'll succeed, maybe we won't. But it never hurts to try. Yeah. And we really think that's a point of emphasis going forward.
I got a few things I'm going to hit with everybody here real quick. Like we talked about doing this guy, we're going in and doing that. Just for a reminder for everybody, your health premium per pay is $34.62. That's what it costs per pay. So it's very reasonable for very good coverage with that. Okay. The paper fill out, there's certain forms that you can't do in Skyward, specifically your beneficiary one, and you're going to need to fill that out because everybody that works for us has a $25,000 life policy. I need to know if in some case, I hope never happens, where to send that money to. Flex, if you do your flexible spending, your pre-taxed money that can be put away, you have for health this upcoming year, you can set aside up to $3,300 for health, and you can set aside for daycare up to $5,000. Okay, so there's a form for flex that you'll have to fill out. Also, paper, your voluntary life, like we talked about, you're gonna need to fill out if you want more than the $25,000, and then the coordination of benefits form. Jennifer's going to get all of these to you. If you have questions on how to fill out any of these forms, please reach out to her. She's more than happy to help you fill any of these out. Most of them you're going to look at are pretty straightforward, but the key thing is all 4 of these forms, whether you want it or not, I need you to sign them and say you don't want anything to do with it, or you do want something to do with it. Okay, so I need all 4 forms returned. Okay, flipping down through that, I've got a couple others. Oh, by the way, sorry. So last year when you had the flex benefits, you had your flex card there, the consociate flex card where you could go in, and we were getting bombarded with everybody need a receipt. Everybody need a receipt. And it got to be annoying, and I finally got a hold of them. I have set it up that anything under $250 that you charge on that. Now, again, you swipe it if you're at Walgreens and you swipe it and you're trying to buy yourself a bottle of wine, it's not going to pay for your bottle of wine, okay? It knows the barcodes and the information along there. However, anything under $250, they are not going to ask you for a receipt anymore. This comes into play mostly at your dental offices because they're not sure if it's cosmetic or not cosmetic. So if you go there and you get Invisalign or you get a tooth cap and it's under $250 and you pay for it that way, know that that would be on you if for some reason that the IRS would come and audit you. Okay. But right now, anything under 250, they're not going to do it. I'm going to go over to health with you guys a little bit more. Steve touched on this. I'm going to say it one more time for everybody. Our insurance is not Aetna. Aetna is our network that we're renting, that we're buying into. Our insurance is Hscsed. So that's been a huge problem where people are, you're giving your card to people and they don't understand. So it has the Springfield Clinic on there, Advantage. It also has Hscsed on there. It also has Aetna. Hscsed is our insurance, okay? Not Aetna. You're trying to get into the Aetna network, which is our PPO network, okay? Last but not least, I think everybody, you want dates. So this is what I've got for everybody. Getting online and filling out your health insurance on Skyward and getting your other paperwork in, we would like to have that all done by December 13th. So if anytime after December 13th, you will not be able to get onto Skyward anymore and fill that out. You will need to contact Jennifer, come into the office to fill out the paperwork by hand if it's after December 13th, okay? Since we're changing over to it, we're gonna be pretty diligent in trying to make sure everybody's plans are the same or close to the same as they have been, or if they may have forgotten something. But at the end of the day, it is your responsibility to sign up for what you want. So in saying that, if January 1st comes around, it's January 1st, 2026 or 2025, and you realize on the 10th of January you made a mistake, I don't care. It doesn't make a difference. There will be no changes made after January 1st, 2025, unless it is a qualifying event, which Steve talked about. I can make those changes anytime if it's a qualifying event. If this is, oh man, I forgot to add, I don't care. Nor does the government. Nothing will be changed after January 1st if this is your mistake. So just know that going forward with it. All right. I had a few questions on there. Like I said, I'm going to put together something that goes over all of our benefits in a little bit more detail. I'll even do a little slideshow and everything else if I can figure that out. But if nobody haven't seen any more questions, oh, I got some questions now. Let me see what I got here. Change. Yes. If one of the questions is, if you don't have any changes to your plan, when you go to Skyward and you hit that open enrollment, if you want no changes to your plan whatsoever, and you know what your plan is, there's going to be a box on that first page. You can click it. It says no changes. You can click it, hit submit, you're done, you're out. Yeah, it's that simple, okay? Yes, the question was on the HealthJoy app. The Hscsed has now been bought out or is in partner with the Berlin's Health, okay? That is the Hscsed. Hscsed and Berlin's Health are the same. Now, a neat component to that on there, if you click on it, and down at the bottom of it, it will give you a list of procedures that are like the most common. When I said it, it's like 300 different procedures that are available to do that. And that's not the exhaustive list for it also. So if you want to know what might be covered underneath that or what could be within that, click on that and look. It'll tell you all those different things that are there. Well, what else we got here? Do we still have the Ash The option to have the district at 1,500 to, yes, you'll be able to see that. You can, if you want the 1,500 added to your, Flex account, and then we put that into your actual premiums and everything, yes, we'll have the same thing for that. But, you've never taken voluntary life, can you now? Yeah, you can have voluntary life right now if you wanted to. Okay, again, Steve hit it. If it's over $10,000, you're going to have to do a physical or something.
There's gentlemen's or ladies that I've never had it. So since the phrase I've never had it is in here, you can apply for it, but you are not automatically approved, but there's no reason you can't apply for it if you're looking for it.
Okay.
Send it through and we'll get it taken care of for you and we'll help you through the process. But again, until notified in writing, you're not covered.
Yeah, and if I don't have the insurance, are we still offering? Yeah, we still have that in there that if you don't take our insurance, I'm gonna lie right now. I can't remember the exact amount. I think it's like 1,500. And yes, 100%, 1,500, and we will put that into a Flex account for you. If you do not take our insurance, we will give you $1,500 Flex instead of waiving the health insurance. So
It's called benefits in lieu of.
yep. And I think that's all the questions I have on there. Now, what about, how do we fill out the coordinator benefits? How do you fill out the coordinator benefits?
It's the second page on the. Okay, you probably cannot submit that through Skyworks. My
No,
question.
you gotta do this by hand, and Jennifer will get that to you.
Yeah, give it to Jennifer. She'll give it to us and we'll get it to Consociate. We'll make sure we've got everything.
Basically what it's doing, it's going down and it's asking you if you have a secondary insurance also on there. So if this is the second one or you have another one at the same time, so just going through and answer the questions the best you can. Again, if you are unsure of one of those, you can ask Jennifer, you can ask me, and we can make sure we can check that, but it's just pretty straightforward with it.
Okay, but this really helps you because let's say, well, no one else has anything covered, so why should I fill it out? Because if you do number one and you check no, and you have a claim for any doubt, if there might be a coordination of benefits, they will waive that and they'll pay the claim. If not, you're going to get a coordination of benefits form mailed to your home. And if you don't get it, then there's no payment for maybe 6, 8, 10 weeks while we're chasing it down.
Yeah.
But if this is on file, you're all set. So it's a great item.
The last one on our mental health services, that's been a question. I actually fired off a question the other day to one of the gals at Consociate about that. So if it's mental health services and it's within the network, yes.
Absolutely. Under the Mental Health Parity Act, there's no differentiation between mental health care and physical health care, for lack of a better term. It should be no different than I've got the flu or I'm going to have my knee scoped. The thing that comes up in mental health sometimes is a lot of counselors may not be members of any PPO network. And that could be not just Aetna, but someone else. In that situation, it's the same also as if you went to a orthopedic surgeon who's not in the network. There's really not very good coverage, but we would take any inquiry confidentially. If you send it to me, send it to my email directly. No one will ever speak of it but me and you. I'll get you the answer.
I didn't see any other questions on there. I'll tell you what, we're gonna go ahead and we'll sign off. This is a lot to digest. Also, we have recorded it, so we'll put it up on the website. And then, like I said, I will get into putting together something very specific on our benefits that just are a little bit more specific. And again, if you see something in our benefits and you're not sure what they are, pick the phone up and give me a call, give Jennifer a call. We can explain that to you, or at least give you a little guide to it. I mean, within also, I forgot about this, we have the cancer therapy center as well, which I would need to explain that a little more in depth, but that's a whole benefit that we have for everybody that doesn't cost anybody anything at all to have that. So, but
And even though we're signing off, and Greg did say, Lance and I agree, I'm sure this was a lot of info. It took a lot of time. Insurance always boring and annoying. Greg and your union committee made this so easy for 85% of the people who work in this district to click no changes and go about your merry way for the holidays. Don't overthink it. If you like what's worked so far, why change it? They've made it right here for you where you just click the button.
there you go. Well, thanks everybody. We had, you know what? I think we had a record turnout tonight at one point. Yeah, we had 59. That's a new record number for us though. So very cool. Thanks everybody for signing on again. Feel free to ask any questions, do anything you need, and have a great rest of your Monday night.
Thank you.
Thank you.
Bye.
You might have to push stop recording. I can't remember. Seems like, I guess